he said, great hype man there. I'm Amy Keller-Laird. I'm the editor-in-chief of Women's Health magazine, and as you may know, May is Mental Health Awareness Month, so we did a big story in the issue in an attempt to bust the stigma, because the stats are really shocking about how many people have mental illness and how many people are not treated, and one of the big reasons is because there's such a stigma around it and there's just not a lot of education. So I decided to participate in the story myself, talk about my OCD, and we have two of the other women we featured in the story. It was a story that was a little hard to get off the ground, because we first had a writer who had a hard time finding women who wanted to talk about it in the story, again, because of the stigma. We had to, work through with our HR and legal teams at the company to make sure we could talk about it, as employees, because there are all kinds of legal things surrounding this. So kind of the reasons that it was hard for us to do the story were the reasons we needed to do the story. So with that, we'll start the conversation. So I'm going to call him Dr. Ben, just so we can be casual here. But we know millions of people suffer from mental illness, and it ranges from all kinds of conditions: schizophrenia, bipolar, depression. So many people are affected. So why is it still that we're so afraid as a society to have these kind of frank conversations about mental health, what it means, and why are we not talking about it?
I think that the reason there's such stigma around mental illness has to do with the fact that it actually pushes on a number of our kind of natural biases. Mm-hmm. We have a natural bias towards against feeling out of control. We have a natural bias against contagion, something that's contagious, mm-hmm. and we have a natural bias against the unknown. And the way these things combine is that it makes people feel like, well, I don't want to sort of get that illness, because contagion has been something that, as our species has evolved, is something that we've always been afraid of. Something that's unknown is something we want to avoid. And unfortunately, all that does is it makes the stigma worse. It makes people not get the help they need. And it's this sort of really negative cycle. So I really think that this article, this panel, is really important. And I'm just really glad to be able to speak about some of these things and to break open some of the myths.
Yeah, it was crazy, actually, in the article, like the number of people who believe that mental illness is contagious, which is just not the case. And also, we had a crazy stat in the story that said a number of mental health workers did not want to live next to someone who had a mental illness, which to me, it's like, if those people who are supposed to be treating us themselves don't even understand this, then there's clearly we need to be talking. So what do you see as the results of the stigma? Like, what do people turn to? One of the things we found in the story was that 60% of people who have a mental illness were not treated for it in the last year, partly because they don't want to come forth and even admit it to their doctor.
Absolutely, and I think that people end up turning towards short-term relief.
Yeah.
Alcohol, drugs, other sort of vices as a way of relieving some of the stress, because they're not expressing it in appropriate forums, unfortunately. And there's a lot of self-medication going on there, and there's a tremendous amount of suffering that is, I see it from where I am, but that as a broad societal issue, we're not dealing with these issues, and unfortunately, and we can talk about this a little bit more, like, we tend to talk about mental illness whenever there's, unfortunately, like a shooting, and the statistics just don't bear that out. The fact of the matter is that it's like less than 10%, I think it's even smaller than that, less than 5% of people with mental illness are involved with these shootings, but because of some organizations that want the focus to be taken away off of guns and onto people, as a result of that, that's where the conversation goes, and so it sticks in our mind that mental illness is dangerous when that's just really not the truth.
Right. And Risa and Amanda, you guys have, you're part of the story. You both felt the stigma firsthand. Can you describe your experiences, what you've faced, and?
For me, it's always been interesting, because I've dealt with depression off and on for 20 years, but when I was very, very ill, the summer of 2014, I was hospitalized twice in the same month, and I started ECT, which is electroconvulsive therapy, because I had treatment-resistant depression and none of the medications were helping me. And that in and of itself was pretty terrifying. But I really was treated so well, just like the other patients, and it's a really safe treatment. But the interesting thing was, one of the nurses who was preparing me for my treatment one day, she just met me, and she said to me, "Oh, you don't look like a patient."
Right.
And my response was, "Well, what am I supposed to look like?" It was so interesting that a psychiatric nurse was making that comment to me. So
that seems to be like what's continuing the stigma that people have in their head. Oh, it's like, people with mental illness are responsible for mass shootings, and people with mental illness look like this, and like, it's, I think that's the hope of the story, that like, we're all sitting up here. If you didn't know us, you just, you wouldn't assume that about us. So I think that's the good thing, to put the face to the diagnosis and show like, okay, you're a quote unquote normal looking person.
Right, exactly.
And what about you, Amanda?
Yeah, when I first received my diagnosis, I was going through a myriad of different diagnoses, from borderline to OCD to post-traumatic stress disorder. And finally, when I was hospitalized and in a deep crisis, I received my diagnosis of borderline personality disorder. From there, I told my mom, and my parents are from a medical background, and they've gone through some psychiatric education. And she said to me, "But borderline personality disorder, you're so nice. How can you have this disorder?" And she was coming from a place of love, and I love my mom dearly, but this just goes to show that there are some stigma out there, particularly with borderline personality disorder, that they are manipulative or distressful or treatment resistant, but that's not the case, and I hope to combat that here today.
Right. And is that, I guess that leads into like why you guys have chosen to speak openly about your diagnoses, what do you hope to gain?
I hope to give a lot of people hope to be able to be a person, to speak out and have gone through the struggle and the suffering and know that they're not alone. And even with the stigma out there, I think it's important for people to recognize their diagnosis, to accept it, and to get the proper treatment from it.
Yeah, and I almost think like once you have a diagnosis, it's almost better, because you're like, oh, okay, it's not just me. There's like medical facts backing up what's happening, and something's happening in my brain, and it's not just like, why are you thinking this way? I mean, at least for me, it's helpful to be like, there's a chemical imbalance going on here. Just like, that's what's happening. Is there anyone in your life who like would not accept this about you, or even on social media, or have you had to take any dramatic measures for someone who just like will not accept this, or just like cannot understand?
I've had certain instances on social media. I'm very lucky. My family and friends have been beside me always. But on social media, particularly if I'm writing about the ECT, I'll get lots of different responses from people saying, you have brain damage now, what are you doing to yourself? And luckily I can read it and actually laugh a little bit, like, well, actually that saved my life.
Yeah.
So there's no brain damage there. It made me better. But there is that notion, that very old notion when it comes to ECT, one flew over the cuckoo's nest, and that's kind of stuck in a certain generation's minds. So that's difficult to combat.
Yeah. Amanda, anything in your life?
For me, I've also been very lucky to receive a lot of support. I think one thing that hasn't been mentioned is self-stigma. And I have dealt with a lot of struggle just accepting my own diagnosis, accepting the fact that I have to take medication every day. It's hard when I was first hospitalized to accept that this is not what I consider being called crazy.
Right.
And that was a big fear for me, being called crazy. And once I did get my diagnosis, that label of crazy went away, and now I have a label of borderline personality disorder, and that's something that I can deal with.
Yeah. And Ben, do you find that that's one of the reasons that people aren't getting treatment because they like almost don't want to know this about themselves? Is that part of it?
I think I really appreciate you raising that point about sort of self-stigma and again, if you don't know what these things mean, there are all of these ideas that are out there in our society about what it means, and there's just again a lot of fear around it. Mm-hmm. And I mean, it's fantastic that you've gotten successful treatment and you're here speaking on this. Unfortunately, you are in the minority. But this is why it's so important that you're sharing your story so that a lot of other people realize that there are treatment possibilities out there for them.
Yeah, and mentioning One Flew Over the Cuckoo's Nest, in the story we did talk about how television has done a much better job recently of portraying mental illness from shows like Girls with OCD and Homeland with bipolar disorder. Is that, Ben, would you agree that like having these, Lady Gaga talking about her issues or Demi Lovato talking about her issues, having in pop culture, having people who other people look up to coming forward is helping to bust the stigma?
Absolutely, and I think that people getting into positions of power that have had treatment, successful treatment, wanting to make sure that these stories are being portrayed accurately and not in a sort of sensational way has been a really nice change. And there has been a much greater understanding of these disorders as disorders, sort of illness in a broader sense, in a medical sense. And that shift over the last, I don't say 15 years, it's been very gradual, is the reason that more people are getting treatment and more people are speaking out, and it's because this is the media leads.
Mm-hmm. And what do you tell your patients to do when they encounter stigma in the moment? How should you react? Like, if you react a certain way, then you're called even more crazy. It's like what's the proper response?
So I'm really glad that you asked this, and it's a very tricky line to walk as a clinician because I have to put my patients' needs first, and stigma is very much out there, and I have seen people that have had problems getting a job once they've revealed information about themselves, and there's still all these forms when you want to get a medical license or be admitted to the bar, asking questions about this, and there's a lot of fear around it, and so I've had to walk the line with people. When there's an obvious comment, just like any stereotype, you have to call someone out on it right then and there, to stop it right then and there and actually let the person feel that they have crossed a boundary. I know it can be difficult. I'm Jewish, and I've a couple of times experienced anti-Semitism. People didn't realize that I was Jewish, and I've been in some pretty uncomfortable situations saying look, that's not okay to say.
Right. And somebody asked me, well, what's your advice for in the workplace? Do you tell? Do you not tell? For me, I've been very lucky. My company is very supportive, and we're in New York City, and it's a more socially acceptable kind of thing. But unfortunately, even though there are laws purporting to protect you from discrimination against mental illness, you kind of have to suss it out in your own workplace and see how supportive they are. I mean, I wish the answer could just be tell everyone, but from the story, we saw, people who had been fired, who had been not had a promotion. Like you said, a physician who was asking questions about mental illness in the third person because she didn't want to say it's me. How do you guys feel about, in your work and how you've, has anyone said anything? What do you do either in work or in life in general when someone says something? Do you try to shut it down or do you kind of let it slide?
For me, I've been pretty lucky in different work environments. I think if anything, I was the one who would get the most worked up. If I was coming in a little late one morning, on Monday mornings, I was seeing my therapist. I didn't want people to think that it was just this cliche, I'm gonna go see my therapist.
Right.
It was for a medical condition. So I think I took that on myself of, oh, I need to prove to them like that I'm going to make up that time, but I didn't want there to be whispers behind closed doors. So I think I've always had that fear.
Yeah.
And until I started really being vocal about my illness, that was how I felt.
It's interesting. I'm a graphic designer, but I work in the medical field, actually in the psychiatric field. And while I was hospitalized in the inpatient unit, and I had a doctor there, and actually it's a small world where I'm working and I see the same doctor that I had in my inpatient unit, and I was terrified that he would say something, terrified that he would not talk to me or approach me or even just, tell other people about what he's seen. And we had a great talk, and he said, of course, I'll keep it confidential. And it's just been an amicable relationship since then.
Yeah, and I think that gets back to what you were saying about self-stigma, the fear that, since this story's come out, for me, it's been like all positive public support, but I was telling them back in the green room, like, I just worry, oh, what if, I have a young son who's in kindergarten, and I worry, like, oh, is one of the parents going to read the story, and then somehow, oh, they don't want to come over for a play date because, oh, she's going to be doing her obsessive thing, or what, this hasn't happened, but it's just my own paranoia. And what do you, Dr. Ben, how do you deal with that? Do you just have to shut yourself down from thoughts like that?
Again, it is sort of a case-by-case basis. There's not one rule, but in terms of your own self-stigma and concerns therein, trying to be present because, just as you mentioned, sort of those are potential future fears, and it's not happening right now. And I think that when we are grounded in the moment, we really do have an amazing capacity to deal with so many situations. It's when we have this sort of anticipatory anxiety about what could happen that a lot of problems start. And so just sort of trying to ground yourself in, well, what's actually happening now? And
right, what's really happening?
Yeah, exactly.
And one thing we talk about in the story is unintentionally contributing to stigma, using words like crazy and insane, which I just heard myself say crazy earlier in this conversation. And we did the story, and I can't stop saying it in the office just because it's so part of the vernacular. At the same time, I don't want to overly police words that have become, that no one's intending it to be stigmatizing. What do you guys think about words like that? Do we need to police ourselves? Should we watch ourselves? Just the way I no longer ever want to use that to describe a person. If I'm saying, wow, that situation was crazy good, is that bad?
I think that the way you said it was, I agree with, that certain words have so deeply penetrated the vernacular that I've found that to be quite an uphill battle.
Yeah.
And so the way that I suggest that people do it is to use the correct medical terminology, clinical terminology, when they're referring to the illness as a way of elevating the conversation, because these sorts of words can trivialize it, but if you separate them, because these words have lost all meaning at this point. And so if you sort of make a demarcation that I'm talking about something medical and clinical, I think that there is a respect for that. And trying to police these words, I just think it's too late in some ways.
What do you guys think?
Yeah, I agree with what Ben said, that it can take a lot of work to be censoring yourself constantly. When my daughter is dancing around the living room and singing, and I say to her, oh, you're crazy. It's not the same meaning. So I think I certainly watch things I say when I'm talking about mental health, mental illness in particular. I use the terms and define them for people, but I don't want to spend my life always censoring things that, the real meaning isn't really understood.
For me, I tend to, I have a little boy, he's about 7 months old, and his hair is up the wazoo, and I call it cray-cray hair. And, it almost is a term of endearment at that point.
Yep.
But what I do find a little disheartening is when you use medical terms and disorders to describe a person naturally, like that person's so borderline or
Exactly. I
she's
think
so bipolar.
when they're
just
not
talking-
really.
when they're not medically diagnosed
Right.
as such.
Yeah, and I think that's kind of the message we all want to walk away, that like we can use those terms when we mean them, when the intent is loving, or it's not when we're describing a person who actually does not fit that medical diagnosis. So thank you to the panel. We're going to open it up to questions. Anybody?
Hello.
Anything? Hi.
Me over here. Hi, thank you so much for being here. I actually just wanted to know your opinion on mental health and homelessness. I don't know how it is in different states, but I know in New York there are a lot of mentally ill people who are also homeless. And you guys were speaking a little bit about stigmas with mental illness, and a homeless person already has the stigma of being homeless and all the things associated with that. So how are they supposed to get treatment and overcome their mental illness when they're also homeless and struggling?
I throw that to Dr. Ben.
Thank you for raising the question. It's an important question, obviously, and we know that there is a large overlap between mental illness in lower socioeconomic populations, which, and again, when someone has an acute illness, it's often not very far to the road of homelessness. And so there is, unfortunately, a large intersection, and part of the problem is the stigma that people are not getting treated. And it really is about treating the whole person. I've been promoting it. There's an organization called Services for the Underserved, which is working with people who are homeless, some of whom may have mental illness, as a way of treating the entire person and helping them to not just look at them as homeless, but to sort of see the whole person and what's going on and getting all the services they need.
And I don't know all the details on this, but I do believe under the Affordable Care Act, there's been some strides toward more care for mental illness. I mean, I know that's something that still needs to be worked on.
That's right. There's a mental health parity law was passed a couple of years ago where mental health treatment is supposed to be on par with all other medical treatment. Unfortunately, it's not always the case even still, and a lot of companies are not providing that level of parity. And so it's really important to, if you are someone that is suffering, to advocate for yourself, because I don't want to demonize the insurance companies, but a lot of times they're not doing everything that they're supposed to do under the law.
Any other questions?
Hi, thank you guys all so much for coming. I really admire your bravery. And I have two questions. First, you talked before about how it can be difficult to separate your feelings and know whether they're coming from yourself or your condition. And I was wondering whether you consider your condition to be a part of yourself, and also if you consider it to be a disability.
At this point, I do feel it's a part of myself. I was suffering with severe depression basically for the past 2 years. I had back-to-back episodes. So as I worked in therapy, the depression was there. So as I grew as a person, the depression kind of helped me grow in a way. So I do consider it a part of me. I was depressed during my adolescence as well, so it's been there. Not always active, but it's there, and I do consider it a part of me. I've taken medications for over 20 years for it. It's just it's who I am. It's someone who has diabetes. It becomes part of who you are. Oh, I have to check my blood sugar now. So it's the same thing. Medical illness is medical illness. My illness medically is in my brain. So that's.
Thank you for asking that question, too. For me, is it a disability? I don't think it defines me as a person, but it is a very deep part of my existence now. I've struggled long and hard with it, and I know that there's so much that came from the disorder, from living with the struggles and the suffering that I would have never experienced without having it. So even though it's a disability, maybe I have to go see the doctor more often, maybe I have to take medication, I find the creativity that comes from it, all these other different gifts that came from the struggle and the suffering provides new meaning for me.
Yeah, and this was something we were talking about backstage. Ben was saying, there are some positives to having mental illness, which no one really ever talks about, and we don't want to, gloss over the large negatives, but, I think looking at it that way can help.
Yeah, I mean, mental illness is something that remains as part of our gene pool, and things that tend to remain in our gene pool are there for a reason. And I do think that there are some, there's well-known consistency between extreme talent as well and mental illness, and in my practice I see that a fair amount. And I believe that, for example, depression, which tends to emerge during adolescence, can have a protective effect on people, because one of the things that depression does is it keeps you from engaging in certain types of behavior, and we know that in adolescence, we have a really poor understanding of risk tolerance, and so I believe that it also can protect people in certain ways. There are downsides, but it's also important to recognize the whole condition, that there are often some upsides to it, and to realize that there are two sides to it.
And what do you think about your patients? Do they consider it a disability? I guess I've never thought of it that way for me, but I'm also on the mild end, so I don't want to speak for the community.
It's very tricky to be able to sort of appreciate the gifts that are often associated with it, and treat the downsides to it. I mean, I often think about, so James Joyce, who struggled with certain aspects of mental illness, had a daughter, and his daughter was very severely psychotic, and he was bringing her around to different clinicians to try to get appropriate treatment for her, and was trying to actually convince them that there was really nothing wrong with her, that she was just like him. And the story goes that he spoke to one clinician who said, look, the difference between you and her is that where you're swimming, she's drowning. And trying to understand that distinction is really important, where someone is sort of swimming in some of this and someone is drowning with it. And when you can help someone who's drowning, that's when you're really making a difference.
Anybody else?
Hi, thank you all for coming. My question is, what advice would you give to friends and family members that are dealing with someone that has been diagnosed with a mental illness?
I mean, I would say, first of all, listen, and don't try to offer, oh, it's all going to be okay, because maybe it's not going to be so okay in that moment. And, not judging, just being open to hearing what they have to say. For me, and not assuming, I mean, for me, it's always like, oh, I'm so OCD too. That's what people say a lot, and I think they mean it in a nice way, and they're trying to be empathetic. But you're probably thinking of, people are always like shocked when they find out I'm really messy, and I'm like, OCD doesn't mean being like super meticulous and neat. I mean, that's like an obsessive personality trait. So I think just not trying to gloss over it with that pat answer, and really just like being open. What would you guys say?
Yeah, I would definitely say listen, support, ask them what could I do to help you? And sometimes they'll say I don't know, because they may not know. I certainly have felt that at times, but just knowing that you are there and you are open and available is very helpful, because a lot of people with mental illness lose a lot of family and friends because they just feel like, oh, I can't deal with that. And that shouldn't happen if you love somebody and care about them.
for me, I think it's important to validate who they are as a person and to really, as they said, listen, but also to educate yourself, and maybe you can educate yourself with that person about the disorder. I think that goes a long way in understanding who they are as a person.
Okay, we're going to be wrapping this up, so I think we have time for one more question.
Thank you all very much for being here. This is definitely an important topic to discuss. The last question sort of covered the ground, but I'm going to get into a summarized story. I had a family member, probably untreated bipolar, and unfortunately, he never sought out the treatment. And I think things could have turned out differently if a person is on proper medication. So I highly encourage anybody that's going through something to do that. Also, I was very much in love with someone for about 3 years who was very open with me about having bipolar, and I definitely appreciated the truth and honesty that she shared with me. I consider myself a very patient, understanding, and caring person. And I was there in every sense of the way, and unfortunately things didn't work out. You can't ever force a person to stay and attempt to get better. That's up to the person. So how would you encourage, if not for me, but for other people who might be in a relationship with someone who has bipolar or a different mental illness, to stay strong and to be there for their partner or whoever?
I think it's such a difficult position to be in. I just think of my husband, and he just saw me over months unravel, and he kept saying, call your therapist, call your therapist. And I said, no, it'll be better in another week. And I kept putting it off because I already was majorly depressed, and my cognition wasn't functioning normally, so I couldn't really see there was another side. So that was very hard for my husband. And then finally I gave in, and I did contact my therapist and went to see her. But I've been very aware that his role as the husband is at times incredibly difficult. And over especially the past 2 years, I've really gained an appreciation of what it must be like for the loved one.
Yeah, just one other point. Just trying to be there, just like Risa was saying, like consistently for that person, and really understanding it as a medical condition, because again, it's very easy for that to get overwhelmed when you're feeling frustrated in the moment, and really, focusing on it as a medical condition, and trying to help the person, just feel understood I think is the key, because then people tend to move towards getting treatment when they feel safe.
Yeah, and there's a great thing is happening where first aid classes that are being tailored, not how do you treat someone if they've been injured in a car accident, but how do you treat someone if they're having a panic attack? This is like a new thing that's kind of happening. The First Lady of New York is kind of pioneering these in New York City, and hopefully it'll happen around the country, but that if more people take these classes, they know how to respond to a person in the moment, that I think we'll get to a better place. But I just want to thank everybody for being on the panel, being in the story. It's been great, and we want to just keep working toward having an open dialogue around mental illness. So thank you so much for coming.